مساء الخير على كل مشاهدينا اللي بيشوفوا طبيب اليوم من خلال النهار اليوم. أكبر معاناة لأي حد فينا هو ألم الأسنان، بجد صعب، وبالذات لما الموضوع يوصل لخلع الضرس أو حشو الضرس. في كمان الأصعب من كده لما توصل الحالة لعملية جراحية في الأسنان. كلنا أكيد جربنا ألم الأسنان، اللي ما جربش هو محظوظ بجد. حلقتنا النهاردة مختلفة عن أي حلقة، لأن برنامجنا مختلف طبعا عن أي برنامج. أولا معانا دكتورة أجنبية وصلت مصر وقررت إن هي تستقر فيها وتعمل مركز يورو فيجن للأسنان. الحاجة التانية هو الجهاز اللي الدكتورة جايباه معاها من بره مصر، وبتقول إنه بيعالج الأسنان بدون تخدير وبدون ألم. لكل الناس اللي بتشوفنا النهاردة هتسمعوا كلام مهم وشيق وجديد. معانا ومنورانا دكتورة جورجيا لاروكا، أخصائي زراعة وتجميل الأسنان جامعة بوخارست برومانيا. قبل ما نتكلم عن المحاور النهاردة وهي كتيرة ومهمة وشيقة، خلونا نشوف مع بعض لثواني الشهادات اللي حصلت عليها دكتورة جورجيا ونرجع مرة تانية. اللي هنتكلم فيها مع دكتورة جورجيا لاروكا هي علاج مشاكل الأسنان بدون ألم وبدون تخدير، وكيفية التعامل مع مرضى السكر في مشاكل الأسنان. Hi doctor.
Hi.
It's nice meeting you.
Nice to meet you.
And welcome to Egypt.
Thank you so much.
We know that you had the Egyptian nationality.
Yes, I have.
So congratulations.
Thank you so much. It's an honor for me.
Thanks. Okay, why do you choose Egypt, especially to open the Eurovision Center?
Since I was young, I was in love with Egyptian history. All the stories about the pyramids and were fascinating me. Later on, I met my husband and I get married with an Egyptian man. So here I am.
Okay.
We decided to bring something European on the Egyptian field, so we opened the Eurovision Dental Center. The concepts and the visions European, we try to implement it here on the Egyptian market. And Eurovision Clinic is trying to bring the best medical care for our patients every day. In a highly equipped clinics, everything is last generation.
And the recent technology, of course.
Yeah. And with superior standard of sterilization for the safety of our patients.
Okay. Would you tell us about this device, system, what do you call it, instruments?
Yeah.
Okay, it's BioLase.
BioLase, water lace.
Contains what?
BioLase, the water lace from BioLase, it works with air, water and laser, safe for human tissue in the mouth.
Yeah.
The laser, it makes contact with the tooth. And because our teeth are containing a lot of water, when the
like our body.
The same our body.
Yeah.
Okay. So when the laser makes contact with the tooth, it excites all the water molecules to cut through the tooth. Since the laser sprays water all the time, it keeps the tooth hydrated and prevents heating. Because heating, vibration and pressure are the main factors that produce pain. So the procedure is painless, no need for anesthesia, no need for drilling. What are the main factors for anxiety in the dental clinics?
Good. So this device can treat or medicate the teeth problems without pain and without anesthesia.
Yes, in the majority of cases.
This is the new technology of
yes, this is
system.
The new technology.
Yeah.
Because
we don't use drugging for them.
No.
Or anesthesia, injection or something.
No, we don't use anesthesia in the majority of cases. Over 95% of cases doesn't require anesthesia.
Okay. What are the suitable cases that this device can treat it easily, and what are the percentage of success?
Water laser is safe for is cleared for numerous dental procedures, including pediatric patients and adult patients. The classic dentistry, it's relying on removing a huge amount of dental structure and spinning and grounding on the teeth. It produces cracks and fissure of the teeth that later on produce
As we see here in the video, doctor.
Yes.
Okay.
Here we can treat a hyperpigmentation gingiva.
Yeah.
Okay. The hyperpigmentation of the gingival tissue, it is a case that with water laser can be treated without anesthesia, without bleeding, without swelling. In the classic dentistry, it requires a scalpel. It requires to open the cut and to remove layers of the gingiva, or with electrosurgery. But the bleeding is huge. The pain and the medication after are a lot, and the patient will need to have coat the area for 2 weeks probably.
2 weeks?
Yeah. In our situation, the patient after just 10 minutes, without anesthesia, without pain, he is able to drink and to eat immediately after surgery. Yes.
Oh, I'm glad to hear this, because you know, teeth pain is impossible, really.
Yeah,
we face it every day with everybody.
Yes, it is. That's why I was so excited that I can bring this technology here.
Okay, good. So you said, doctor, now without swallow and without bleeding.
Yeah.
That means the patients who suffer sugar diseases, you can deal with them easily then?
Yes, we can deal with them easily, because the sugar problems is a very huge challenge for the dentistry.
Of course.
And
it's a big problem.
Yes, it is a big problem. So with this technology, it's no bleeding, it's not need for anesthesia, which is a problem for diabetic patient.
Of course.
Not need for post-operative medication, pain medication, and no antibiotics as well, which is very, very rare in case of diabetics. They don't
need to take any kind of antibiotic?
In most of the cases, no, because the lasers is reducing the bacteria, the amount of bacteria on the tissue inflamed.
So this is the new technology.
Yeah.
That they don't want to take anything. They don't need to take any kind of antibiotics or something antibacteria, because this system or this device is treating or medicating this easily.
Yeah, it's increasing the healing. The healing is producing faster because of this treatment. It's reducing the prostaglandin, the one that produces inflammation. So will be no inflammation, will be no pain, no sensitivity after, which is great.
Okay, doctor, you solved a very big problems we faced with patients who are suffering from sugar diseases, and also you solved the problem with our children. We face every day a big problem with our children. When we are going with them to the dentist, they said, oh no, we don't need to go. We said, stay calm, calm down, it's very easy, it's okay, you are going to face a problem with them. So this system or instruments is solved problem with the children. We cannot handle our children, of course.
Water laser is perfect for children. It's not need for that big needles and the noisy drill that make the children to be so scared. And the mothers and kids love no dentistry without any pain. So this technology is the perfect for the kids. Is a friend, very friendly with the kids.
Does it cost much money, doctor?
No, it doesn't.
Expensive? Because many people, of course, wants to know.
Yes, we are always asking this question, but surprisingly, no, it doesn't cost much money, and if we have to report it to the benefits and the advantages, and we save time, and we save between the schools and work and everything in between. You don't have time to reschedule another dental appointment because it doesn't require anesthesia. The dentist can perform many routine procedures in a single visit in many areas of your mouth.
Okay, what are the most difficult cases that the device can treat it or medicate it easily without side effects? And what are the side effects of using this system or instruments?
This system has no side effects at all. It's reducing actually all the trauma and the pain that was so scary with classic dentistry. They can treat over 90% of the classic.
Which is good.
Which is good.
Of course.
Yeah.
What is this video? Tell us, doctor.
In this video, we treat hyperpigmentation of the gingiva. The water lays, compared with the other technology, it just peeling the gingiva.
Yeah.
Okay. Layer by layer until reach the basal layer of the gingiva and remove all these stains that make the patient to feel discomfort.
Good.
So it is a very nice technology, especially for this case. Actually, the patient is smiling immediately after the procedure, can eat, can drink, and as I said, no medication required.
Really?
Within 5 to 10 days.
Is there any obligation for the patient they must follow after using the device?
Not necessary, only the normal hygiene standards, not more than
what
that.
Is it?
To brush the teeth twice a day, to use a dental floss, to use a mouthwash.
Doctor, twice only?
It is good to brush morning and evening.
Yeah.
If you have time for 3 times,
it's better, of course.
But we have to be carefully to don't brush immediately after we drink or eat, because the acid drinks produce a soften in the enamel, so this will be a problem. We have to be careful with the technique that we use to choose a toothbrush that is suitable for our mouth. And also are additional brushing devices like oral irrigators or electric brushes that helps the patient with arthritis problems or with other difficulties.
Good. What do you expect from the people here in Egypt to be excited with this system, or what?
Yes, they have to be excited because it offers a lot of benefits. It's faster, it's safe, it's precise, it's accurate, it's reduced cross-contamination. If you know, cross-contamination is encountering bacteria where you're less expecting.
Of course, yeah.
And the medical environment is highly risked for such bacteria. So because the laser doesn't make contact with the tooth, you don't have to worry about what was in somebody else's mouth.
Yes.
Sure, and especially that the dentist
It's totally safe, doctor.
It is totally safe.
Good. Okay, what is the advice that you want to tell all the audience that are watching us now, or the people that they are watching us now, to take care of their teeth and being healthy?
They have to brush the teeth every day. Don't forget that, it's very important.
3 times? Twice?
If we don't have time, 3 times, at least make it twice. Okay. And
what about the mouth? With
the mouth rinse, it is important, but only to remove the food debris that that can remain after brushing or flossing.
Of course. Okay. Yeah.
And to use the proper toothpaste that it's according to the age and to the case.
Toothpicks?
Yeah, the toothpaste are cases where it's not indicated the fluoride toothpaste. The children under 6 years, they have to take it in the very small amounts under strict supervision of the parents.
It's very important to tell them that.
Yes, it is very important. And are cases where the fluoride can produce actually disasters for the teeth.
Really?
Yes.
Okay, doctor, we thank you for this piece of advice. Really, we are glad that you are here in Egypt. And congratulations for the Egyptian nationality, and congratulations also for this center you open and for this device, Eurolace.
Yeah.
Biolace.
Water lace from
Water lace, biolace.
Yeah.
It contains water, air,
and
laser, of course.
Yeah, yeah.
And
That
laser,
is
of course.
suitable for human tissue in the mouth. Yeah.
Wish to meet you again,
Thank
Doctor,
you so
another
much
time.
for having me. It was an honor to be here with you. And remember, keep smiling.
Thank you. اوكي احنا بنشكر بنتوجه بالشكر للدكتورة جورجيا لاروكا، اخصائي زراعة وتجميل الاسنان بجامعة بوخارست رومانيا. الحقيقة دكتور جورجيا قدمت لنا معلومات مهمة وجديدة جدا فيما يتعلق بأحدث التكنولوجيا للعناية بالفم وبالأسنان. طبعا الأساسي والمهم فيما قدمته الدكتورة جورجيا هو هذا الجهاز اللي يعني بيدخل في تركيبه المية والليزر، وبيتعاملوا مع الأسنان بشكل آمن جدا، بشكل مش محتاج إلى تعقيم لأنه أنتي بكتيريا، كمان مش محتاج إلى تناول أي نوع من أنواع الأنتيبيوتكس أو المضادات بعد استعمال الجهاز. يقدر الإنسان يتعامل جدا، يأكل ويشرب، ولكن مع الحفاظ على سلامة أسنانه. النصيحة الدائمة اللي بتقدمها الدكتور سواء استخدام الجهاز قبل أو بعد، لابد لينا من العناية بسلامة الأسنان، لابد من غسيل الأسنان بشكل دوري ودائم مرتين على الأقل في اليوم. استخدام خيط الأسنان والتوث بيكس مهم جدا. استخدام الماوث ووش أو غسيل الفم أيضا مهم جدا. دي حاجات مهمة لازم يعني تستوعبوها وتكون موجودة ومترسخة في ثقافتكم دايما، من أجل ابتسامة دائما جميلة ودائما رائعة. Okay, doctor, what do you expect? Do you expect more technology for the teeth care? What do you expect?
Yes, I expect new technology to come, including also the...
Including what? Contains what?
Are new research these days,
yes,
that are showing actually they can grow new teeth from this new cells. So this will be great to can actually make a new tooth growing. And but better than this is to prevent the cause of losing our teeth.
Okay, what about whitening the teeth?
Yeah.
What's the latest researches for this?
The latest researchers for water lace showing that sensitivity, it is reduced. Actually, nobody complain of having sensitivity, and it give whitening.
Is it deal with that's what I want to ask you. Is it deal with the whitening?
Yeah.
Also?
The shade improves from 2 to 9 shades.
Really?
Yeah.
From one time?
From a single visit. Yeah.
A single visit only?
Yeah.
They can feel comfort.
They can.
With the color of their teeth.
Yeah, it is much improved. Yes.
Okay. What about children problems? You know, children problems is very common these days about their teeth. They don't follow the hygiene obligations well. So, what do you advise them using this system?
This system is perfect for kids.
Yeah.
What makes
it a kid friend?
Yeah, it is a kid friend.
It's a kid friend.
Yeah, it is. So this device, it can help the child to come often to the periodical treatment and to prevent all the decays and all the problems that can make problems for him. But with this device we can do a lot of treatment for children. Majority of cases can be treated with this, including the pulpotomy, so to take out the pulp from inside the tooth. It requires an anesthesia. Here we don't need this, and we can
drugs
after. So this is wonderful because it's just like a playing for them.
Really?
Yeah.
So it's a good news for them.
Yeah, for them and for their parents.
Okay. What about the Hollywood smile that
Yeah.
many people want to make it?
Yeah, the Hollywood.
What do you say about it?
The Hollywood smile, you have to make it when your mouth is healthy.
Of course.
When the teeth and all the structure of your mouth are healthy. It is something that you want to do, not something that you need to do. Okay, compared with the full mouth recovery, where you have to treat from one tooth to all problems in your mouth. Okay, so Hollywood smile, yes, can improve the aesthetic, can give you a wonderful smile, and in some cases, yes, it's I can advise for it, but
In some cases, you said?
yeah,
Not all the cases?
not all the cases are suitable for this. Our
Really?
patients, everybody is different.
Okay.
Yeah, so we have to be healthy, and after that we improve the quality of our smile.
Good. Okay, keep smile, doctor. And we want to say to our audience that please keep smile by healthy teeth, of course. So we wish you good luck, Doctor Georgia.
Thank you so much. Thank you so much.
What do you want to say to the Egyptian audience at last?
I am happy to be here, and I hope our center will improve their experience on the dental field. I hope we can reassure them that dentistry can be a nice experience.
Okay, Doctor. We wish you a very good luck in Egypt.
Thank you so much. Thank you so much. The same to you.
Thank you. إذا مشاهدينا ده كان وقفتنا النهارده، وقفتنا المهمة جدا مع دكتورة جورجيا لاروكا، أخصائي زراعة وتجميل الأسنان بجامعة بوخارست برومانيا. تحياتي واشوفكم إن شاء الله في الوقفة الطبية القادمة.